Welcome back to iCatConnect 2025. Thank you so much for coming back and joining us. Hope you had a good lunch. Hope you had a good break. If you did have lunch, wherever you are in the world, might not even be lunchtime, but welcome back anyway. Thank you, first of all, so much for all the comments and engagement that we've seen in the chat. While we were on break here, we were looking at it, myself and the team here at iCatCare. Really fantastic engagement. Please keep it coming. Really want to hear from you, where you're from, what you're doing, the work you are undertaking, any thoughts, challenges you're facing, questions that you have for the up and coming panels. Really loving hearing from you. So next we have, we're going to tackle actually one of and discuss one of the toughest parts of the work that we do in cat population management and cat welfare, which is end-of-life decision making. It's a really tough issue and one that that the next panel will be discussing. But before we have the panel, we've got a short film by Vicky Halls to introduce the topic, and then when we come back, Seb is going to take over running the panel. So I will see you a little bit later on. After the video, Seb's going to come along, but here is a short video by Vicky Halls, and we'll see you after that.
Welcome back. I want to talk to you about euthanasia. Now, I know this is a very difficult topic, but it's a necessary one. There are many millions of unowned cats around the world, more than the number of cats that live as pets. The cat's ability to reproduce, even in very difficult circumstances, means that numbers continue to rise, fueled by an increasing demand for pets, often without considering neutering, and a lack of joined-up thinking on humane population management. All organisations and individuals supporting unowned cats, and there are many, have an ethical responsibility to provide them with good welfare. That applies whether they are trapping, transporting, neutering and returning cats in TNR and community cat programs, or whether they house cats with a view to adoption, or whether they run sanctuaries where cats remain that have nowhere else to go. In all these places, there will be cats that are silently suffering, both physically and mentally. Many cannot be made better because of lack of veterinary care, funds, expertise, homes, or suitable environments. Unfortunately, in some cases, there are other barriers, lack of knowledge, an inability to accept that euthanasia can be a positive welfare outcome, or simply because it feels too difficult. It's not because people don't care or don't have the right motivation. Let me explain. Cats' natural behaviour is to be highly aware of their environment and to protect their vulnerability. They are masters of disguise when stressed, ill, or in pain. A cat in a homing centre is in a strange and stressful place, but assessing suffering is difficult. Physical suffering in the period leading up to death should not be inevitable. When such suffering cannot be effectively reduced or prevented, humanely ending the life of the animal, euthanasia, must be considered. Probably the easiest end-of-life decision, if there is one based on obvious physical suffering. The mental or emotional aspect of welfare is an additional dimension that must not be ignored simply because it's difficult to assess, or because acknowledging its presence means that tough decisions need to be made. In human medicine, the assessment of welfare incorporates negative feelings, including fear, anxiety, sadness, and depression, as well as the patient's ability to cope. Consideration of these feelings, as far as we understand them, is now also included in the assessment of animal welfare, and needs to be based on knowledge of the biology of the species, and in particular, the methods used by animals to try to cope with difficulties. We need to recognise the signs that indicate cats are coping or not coping. In simple terms, for quality of life to be good, individual cats must be able to control their interactions with their surroundings and express their natural behaviours. This can be very difficult in a cage or pen. It comes back to understanding what cats need and how those needs change according to the spectrum of lifestyle that exists in the species, from feral cat to pet. Not all cats are suitable to be or would enjoy being pets. It wouldn't be the right thing for many to be forced into pet homes or exposed to the constant presence of people because we, as humans, think we know best. It's not right for cats, incapable of living comfortably as pets, to be kept in cages. We should look for solutions that meet their needs instead. If a cat's mental well-being is reduced, for example, those that are continually stressed because they have difficulty in coping with their environment, this can also be considered poor welfare. They feel overwhelmed. They experience a low mood and lack of interest in their surroundings and things they previously liked. Cats confined in cages or pens for prolonged periods become withdrawn and non-responsive. Poor mental well-being and distress are also associated with a reduced immune response and increased risk of disease, leading to impaired physical health too. Helping cats is not just about removing them from a bad situation and placing them in safe confinement. Cats live in the moment. They don't understand the motivation of humans keeping them confined today so that they have a better chance at life tomorrow, and this needs to be considered when assessing quality of life. For example, keeping a cat in a cage for years in the hope of providing a future life worth living is not a good life now. Therefore, simply minimizing or resolving negative physical or emotional states is not sufficient for good welfare. There needs to be positive experiences too. Confinement has its place, but there are important limitations and consequences for some cats, which we must acknowledge. So that's great in theory, but everything becomes challenging when the number of unowned cats keeps rising and the demands on the sector are increasing. It's never ending. Some of you will have legal restrictions, some have no choice but to take all cats into care. Others are just responding, understandably, to the crisis of overpopulation. So what happens when cats get sick or stay in care for prolonged periods? We need to accept that despite our best intentions, this compromises their welfare. To prevent suffering that cannot be resolved, decisions need to be made. The goal of that decision is to find a home as quickly as possible. But if that isn't possible or likely any time in the future, then euthanasia for welfare reasons should be considered. And that's tough, to say the least. Nobody wants to end a cat's life, especially if they've been caring for that cat for some time. Staff and volunteers who've been in this situation, myself included, know what I mean when I talk about compassion fatigue, moral distress, guilt, hopelessness, and that awful sense that none of us got into this work to end lives. We want to save them. But our difficulty in making these decisions causes problems for cats. End-of-life decisions can be made too late or not made at all, and that causes suffering, and that's an unpalatable truth. And we can argue where there's life, there's hope, or say things like, I can't play God, I can't decide when life ends. And as we resist making that decision, cats continue to experience physical or psychological pain, day in, day out. If we can't end life, we must end the suffering by working very hard to find a better outcome. So how can we change the sector mindset from anti-euthanasia to anti-suffering? I'm going to attempt to answer two questions. Firstly, how could we make this easier for people and better for cats? And secondly, how can we avoid the need for such decisions to be made in the first place? To answer the first question, we need to ensure that everyone working with cats can recognize what suffering looks like and what constitutes quality of life for cats, both in the moment and the future for any particular individual. We need to acknowledge the range of both positive and negative experiences that a cat may have while in care. And to do that, We need to immerse ourselves in what matters to cats and how they experience the world. It's very different to my or your perspective. And once we can assess this and we judge the cat's quality of life as one worth avoiding or worse, then we act and we do something to fix it. Can we find ways to reduce end-of-life decisions by improving quality of life? Yes, we can. We need to find homes for cats as quickly as possible. We have to be proactive. We need to recognise that we can only do so much. We can't save all the cats. We can limit intake to avoid overcrowding, which reduces the incidence of distress and susceptibility to disease. We can enhance the environment from a cat's perspective, ensuring that every cat has somewhere to hide. And we can remove barriers to adoption. These are just a few of the many things we can do to improve quality of life and reduce the need to make end-of-life decisions. The answer to the second question is even more empowering. How can we avoid the need for such decisions to be made in the first place? We need to start working differently. We need to recognise the value of learning. None of us were born with an innate understanding of the cat. There's no shame in saying that all of us can provide better care by seeking out new knowledge. International Cat Care's cat-friendly homing model can provide you with a framework to work with. Cat-friendly homing has the tools to help you transition to a new way of working that puts cats front and centre. Wherever you are in the world, whatever your challenges or resources, you can embed at least some of the elements in your working day, and prolonged cat suffering can be prevented, so end-of-life decisions will rarely need to be made. In easy sections, cat-friendly homing training will take you through all the aspects of intake, care, and outcome that you need to know to improve the welfare of cats. You will help even more cats, and they will move through your homing centre quickly to the outcome that suits their individual needs. The other really important thing we need to do is understand the significance of the bigger picture. Why are there so many cats? Where are they coming from? We need to actively look at cat population management and how we can stem the flow. We need to start working at root cause level and not just keep firefighting the symptoms. You may say that this doesn't apply to you. You would never make an end-of-life decision anyway. Cats in your care don't suffer. They're all fine. You may be legally restricted regarding what criteria allows euthanasia. You may just not be able to even consider this as an option in your wildest dreams, but please, at the very least, take some time to consider this. What does suffering look like in the cat? A species that is self-reliant and naturally hides pain, both physical and psychological. Can you recognise it? Can you relieve it? For more information on this topic, read the paper, Cat-Friendly End-of-Life Decision-Making, Euthanasia, How to Avoid It and When to Use It to Support Cat Welfare. Next on the agenda today, we have a discussion chaired by Professor Severine Tasker with a panel of experts who know what it's like to have to make these decisions. I know this is a tough subject, so thank you for listening.
So a huge welcome back to the studio for this afternoon. We've had a fantastic morning already, I know, and it's really good that you've all joined us again. Keep the chat going. It's fantastic to see so many people from so many different parts of the world joining us, so thank you. So what we're going to start off with today is an end-of-life considerations panel discussion, which is quite a difficult subject. We acknowledge that, but it's a really important one for us to be able to talk about. So that's why we're going to devote some really good time to it. So we've all watched that really moving film from Vicky, just to give us some sort of real pointers as to how we need to think about this subject. So that's going to sort of be the starting point for our discussion this afternoon. So I have got an amazing panel with me today. So I've got a couple of people in the studio with me. I have Claire. So welcome, Claire. And then we've got the wonderful Vicky with us as well that you can see there. So a warm welcome to you two. And then over here, and I can see them as well on Zoom, joining us from all different parts of the world. It really is incredible. We've got Caroline, first of all, from the UK. So hi, Caroline. We've got Adele, who's joining us from Greece. We've got Chicha, who's from Indonesia. So a warm welcome to you as well. And then Candice is in Australia. So I think we ought to almost need to give you a round of applause to start with, because I dread to think the timings. I haven't done my world clock to find out what time it is for some of you, but I know it's going to be really, really late. So, but thank you for joining us and for bringing your expertise today. Just while we do this panel, we have got some time towards the end of this panel discussion for us to be able to tackle some of the questions that you're going to be giving us. So please do keep those going on the chat, and by some magic, I will have these on the iPad for towards the end of the panel discussion. So please do keep doing that. And we'll get going with our sort of panel questions to start with. So I'm going to move over to Claire, first of all. So we've all watched Vicky's video, understands sort of the complexities of that, and part of what Vicky talked about and what hopefully we're all aware of is these amazing decision-making documents that are there, really sort of pragmatic, useful on lots of topics, but one of them is euthanasia, as we have talked about. So, you know, what made you tackle that subject? What drove you to do a paper on that?
Well, I think iCatCare has always been brave, I suppose you might say, in tackling difficult subjects that need to be aired. And also, I think the ability to bring together what we know and then try to build on that and use experience of people as well to build on that. So those decision-making papers take into account research, but also almost mood as well, and how people feel about things. So euthanasia was an obvious one. And it was quite an undertaking to tackle, really. It's a complex subject, as we know, and, you know, to undertake euthanasia, there are practical decisions, emotional decisions, there may be legal things, there may be cultural things. All of those things together make it quite complicated to do. So looking at everything, so how do we start, really? And, you know, where do you start? It's obvious. What is the focus of us all? What is the subject we want to be looking at? And it is the cat, but do we know enough about it? As Vicky said on her video, you know, do we know enough to know what their quality of life is, what they need? Can we read them? You know, and there's lots of things available now, and we talk about those in the paper, for you to, even if you're not a vet or a behaviour specialist, to understand what pain looks like, what fear looks like. If cats are comfortable, there's ways to look at those things to see, you know, where is this cat that we have? And to be honest, once you see it, you can't unsee it. And that is the starting point for everything. And then, as Vicky said, taking into account things like cat-friendly homing, those sort of things, step by step in looking at those cats. What can you do better? If the cat's not doing well, what are the things you can put in place? Logical steps that will help many, many cats. And then maybe a few you can't help, you have to make a decision about, you have to take responsibility for. And so I suppose we're trying to give people confidence in this very complex decision-making process, that they're doing the best for the cat in their individual circumstances with all the different pressures on them. And we even know social media is a massive pressure on people now. People criticising without knowing the individual circumstances and things like that. So you want people to be confident in the way they've got through it. So that's the basis of our decision-making papers, really.
So recognition as well as tools as to how to handle some of those really difficult decisions as well, which is brilliant. I have read it, so I can say that with honesty. So thank you, Claire. So moving on to you, Vicky, just in terms of these end-of-life decisions, what sorts of cats would you say we're going to be talking about when we're faced with some of these decisions and discussions?
I think if you look at the lifestyle spectrum of the species, the infographic that some people may be familiar with that talks about the feral cat, the street cat, the pet cat, and that lovely in-betweener, there are opportunities working with any one of those cats to actually decide whether or not a euthanasia decision is appropriate. Now, for the feral, for example, the street cat, this could be part of a TNR program whereby the cat has been trapped, there is an obvious disease or trauma, injury of some sort, and then that decision has to be made at that point. Is this something we can fix as a part of this process of TMVR? Is it something that requires ongoing treatment? Is it something that's going to be highly distressing for a cat that's unsocialised and not used to being handled by people? So that's probably the kind of decision that you're having to make for those cats that are unsocialised as part of a TNR programme. But of course you have all the cats that come into shelters and homing centres as well. And it's not just about physical health. I think, you know, I mentioned that in the video. We have to realise that mental suffering, and as human beings, we know there's lots in the human literature about people describing acute depression as being just about the worst pain they've ever experienced. So why would it be any different for the cat? Psychological pain is real and suffering is real. So with cats that are maybe in a shelter for months, years, these are the sort of cats that really we should be looking at and thinking, what's in this for the cat?
Yeah.
What is the cat's quality of life now and potentially in the future? So this is why a lot of the emphasis in that paper is about how can we change the system so that you're not presented with a situation whereby you're seeing all these cats thinking, I'm going to have to make some tough decisions here. What we're saying is change the system. Make sure that the cats you take in are cats that you can see a pathway through your shelter, and these cats are on a pathway to being adopted as pets. We shouldn't be taking unsocialised cats into care and putting them in cages, despite our good intentions. So basically, in answer to your question, any lifestyle within that lifestyle spectrum, we should be considering these end-of-life decisions.
Yeah, it's not sort of a pigeonholing of a certain situation because it's so variable depending on the cat, the environment, etc. So that's why it's important to talk about it and understand it, isn't it? No, absolutely. Thank you. I'm going to move to Adele. Are you there, Adele? Hi, Adele. Just in terms of, you've got a lot of experience in terms of your work with unowned cats. Love to just hear from you as to whether you see examples of cats suffering in the work that you do because some of these decisions are hard to make.
Sure. Can you hear me okay?
I can. Perfect. Thank you.
Cool. So definitely do. Of course, every country is different regarding decisions around all of this. I'm currently in Greece, but I've seen examples from the field in Romania, Vietnam, Albania, and every place and organization is different. There's also a few perspectives of how people approach things. So from a TNR program perspective, situations we have to deal with, decisions we have to make around euthanasia vary. I can think of one example where during a very high volume TNR program where we were not typically taking cats into care because there was no shelter in Athens in Greece, we came across a very friendly but diabetic, symptomatic, struggling cat. And because we did not have a pathway set up for them to receive care for their diabetes, they kind of just sat in vet clinics for weeks. That meant being passed around to different clinics. It meant sitting in kennels in unfriendly environments, stressful environments, and not getting their needs met. And there was no end solution for this cat. Euthanasia could have been a really good decision, a good outcome for him. Good in the sense that this would minimize the suffering that he was experiencing in hospital. From a shelter medicine perspective, I can think alternatively of an example that ended positively. I was in Romania a few weeks ago for the first time, visiting a shelter, and we were doing some training and field work around TNR and mapping and things like that. And there was a situation where 3 young kittens, around 2 months, I think, were found in the field being taken care of by a foster volunteer, and they all had, the classic eye infections that we see in young kittens born outside. Very treatable. The trouble is, they were very unsocialized, and in order for them to receive treatment for their eyes, in order for them to not lose their eyes, they would have to be handled multiple times per day, have their eyes cleaned, receive medication. And because they were not comfortable being handled, because they were not comfortable being around humans, they were having a really bad time. Then we discussed, is there an option for them to come into the shelter and be treated here by the vet team? And once again, because they were unsociable, but also this shelter also had to function and had a capacity limit they had to abide by in order to give all of the animals good quality care. This would put a huge strain on them. And so we all gathered and discussed all of the different factors, the pros, the cons, the options. And they decided, rather than putting these 3 kittens who were kind of on the socialization window but would not be able to be socialized because of the care they needed to receive for their eyes, all of us together decided to make the difficult decision to euthanize them. Some people would really struggle with this because they have potential to be fixed, they have potential to be alive. But the question was not, can they be alive? It was, what kind of life will they have if we keep them alive, if we do this treatment, if we keep them in a shelter and they grow up to be feral cats. So from all of these examples, my big takeaway, a lot of what Vicky mentioned before, is rescue doesn't necessarily equal welfare. And that's when this discussion of euthanasia as a good outcome, a good welfare outcome, can come in.
Well, such a good example. Thank you, Adele, because that really does bring it home to us in terms of the difficulties that we can have, and also just thinking about that, the euthanasia as that sort of welfare option is sometimes quite difficult for us to think about, isn't it? But it's an absolute, such a good highlight there, so thank you. I'm going to move to Caroline now. Hi, Caroline. So you're based in the UK. So we've just heard there from our panel just talking about how important that mental well-being is for in terms of how we can assess our cats, etc. I'd love to get your perspectives on how prepared you feel we are as a sector to sort of assess a cat's quality of life, including its mental well-being, because that's going to drive us to be able to make those good decisions from a welfare point of view. Could you elaborate on that, please?
Yeah, but firstly, actually, I'd just like to come back on a point that Adele made that I think was so well made about what we actually mean by rescue, because I think this does hit, the heart of this topic, and actually it's something we've done at the RSPCA is really redefine how we talk about rescue. We used to talk about rescue as the scooping up, the collection, the scooping, the rescue. And we have really redefined that as we've only rescued that animal when we have improved their welfare. And that improvement in the welfare has to be across the 5 domains, which is the kind of scientific, basis that we use. But essentially, that is about not just health improvement to a good, level of health, but also around the environment, the nutrition, and really importantly, the behaviour. And I think that brings us back to the question, which is, are we really able to assess that mental suffering? And I think we are getting better, but I think it's something, that I've reflected on as a vet who spent 20 years in practice before joining the RSPCA. I did not have that understanding. And I've learned so much from working with behaviourists. And I think, as vets, going into these shelters, supporting teams, making difficult decisions, we've really got to lead by example to be really engaging with our behaviourist colleagues, making sure that we're looking at the literature, really educating ourselves, using the tools. I find tools are so helpful because none of us want to be that kind of authoritarian vet, pushing, making the decision. It is about how we bring people with us and, continue to educate ourselves so that we can help, educate other people. And I think there's another important part here is while we're talking about, mental well-being of the cats, of course, but we also do, I think, even as vets, need to have an understanding of that, the ethics that sit behind this for the people and the moral injury that can sit behind that for the people involved. And I actually think if we have a better understanding of that, that can help us, be empathetic and, have these conversations in a better way. And we really do need to have them because I really do believe that euthanasia is a positive welfare outcome and it can equal rescue.
Absolutely. No, thank you, Caroline. And I think, you made a really good point there about, I think the acknowledgement and the awareness of that is definitely improving, isn't it? I think amongst vets, I think sometimes we're a bit challenged by things like social media, and there's other avenues coming in that sometimes challenge our abilities to be able to sort of think about that mental well-being at the same time, but we absolutely need to sort of champion that. And also I think be curious, because I think we're all on a learning curve, and I think some of I've just done the cat friendly homing course, and I think one of the things that really stood out was sometimes people are saying I'm not perfect, I don't know, I'm learning all of the time. And I think that's really important because we don't want to it's about everyone learning rather than just being an expert in that field being able to do it. So that's a brilliant point. Does anybody else on the panel want to come in? Has anything popped into their heads just based on what we've talked about so far? No? Should we? Yeah, Chicha, go for it. Hi there from Indonesia.
Hi, thanks, Steph. So I think just easily assessing quality of life is to see if the cat can do the usual things that they can do. Like, for example, like, are they able to eat by themselves? Are they able to urinate or defecate by themselves? So I think that's kind of like an easy way to see if their quality of life is good or not. Because if they're not able to do it, then, I mean, that just means that they're suffering because they can't do the things that they normally have to do, but they can't do it by themselves. So I think I just wanted to add to what Caroline has said. So.
Thank you. Yeah, absolutely. I think that just brings us, I'll stay with you, Chicha, if that's all right, because I think there's that variation as well. There's going to be sort of cultural elements and how suffering is recognised, as an example. So just thinking about you, in Indonesia, just to give your sort of an international perspective, Chicha, just in terms of, are you seeing suffering, in your line of work in Indonesia? And could you just elaborate on is there an anti-euthanasia? Is there an anti-suffering? Where is the narrative where you're working, please?
Yeah, so in the field of work that I'm doing, I work as a shelter veterinarian, so automatically I see lots of cat suffering. But I think before talking about anti-suffering, anti-euthanasia, I think what people need to recognize more is what suffering means, because it can look different to different people. So, for example, like what Vicky mentioned in the short film about a cat that spends most of their life confined in a cage 24/7. Well, in Indonesia, it's a very common occurrence. Like they're stuck in overcrowded shelters where they have little to no attention to their physical and mental well-being. So for some of us, it's obvious that they're suffering, but for a lot of people here, they think it's normal and it's better than having them roaming on the streets where there's a risk for starvation, getting run over by cars. And there's also this perception of keeping cats alive no matter what is better than giving them a peaceful passing by euthanizing them. So yeah, I think what we should be doing is focus more on reducing suffering. So be anti-suffering and, start to improve their situation if it's bad, rather than like being anti-euthanasia. I hope that makes sense.
Yeah, no, absolutely. And is that something you've done something with in where you're working? Are you sort of involved in the education of that?
Not formally, since we don't really have like shelter medicine in here, but I try my best to raise awareness within like my colleagues to kind of like try to take a closer look and listen to what the cats are saying, especially when they're in pain. And I try to emphasize to them that when you decide to end their suffering, it doesn't mean that you're failing, because euthanasia is not cruelty, but you're actually making the cat's welfare a priority. So that's what I'm trying to convey to my colleagues.
Oh, well, thank you for doing that, because it's an important job. And I think it is really important, isn't it, to think about how those people that are making those decisions, being able to support them as well, because actually the right decision can feel really uncomfortable. So absolutely. Anybody coming in? No, I just saw a hand move there, so I was just checking. So Candice, there you are. Thank you for joining us. I won't ask you what time it is for where you are, but great to see you. Just in terms of where you're working in New South Wales in Australia, I did Google Earth on your clinic last night, Candice, and it really is an eye-opener in terms of the area that you're covering. So incredible work that you do. But I know that you've been in an environment where there has been a need to do euthanasia regularly. I would just love to hear a little bit from you in terms of following on from Vicky's video. What have you been doing in terms of trying to prevent those decisions about euthanasia needing to be made? If you can talk us through that, that would be fab.
Yeah, so you're right. I work in a very remote part of the country, and we're not attached to a shelter. I just work at an RSPCA clinic. We do work closely with the local council pound though, and previously a lot of the roaming and stray cats were being trapped and brought to us for behaviour assessments, and they weren't suitable for rehoming as pets. So unfortunately, a lot of those cats were euthanized because they just didn't have anywhere to go. Now we're part of a statewide initiative with RSPCA New South Wales that's currently working across 30 council areas across the state. And part of this project is identifying the caregivers of these street cats, as well as owners who may be overwhelmed with too many cats and can't afford to get them desexed. And we're able to assist with free desexing to help these people so that these cats can live their lives without continuing to contribute to the cat population. We've been able to get the local council on board with this new initiative, and we've been able to reduce the number of cats being brought in. And now we're focusing on this targeted desexing program. It goes back to International Cat Care's cat-friendly homing principles, that only cats suitable for rehoming as pets should be coming into the shelter or rehoming facilities.
Brilliant. Yeah, so it's just really thinking about those things that we can learn to sort of bring them into place to try and, it's just going upstream, isn't it, as well as downstream. I hope I've got that the right way around. I have, yeah. No, thank you. Anybody else got any thoughts to come in on that from anyone? Shall I move on to just to stick with cat-friendly homing, if that's all right? I'll come to you, Vicky. Just in terms of, because obviously you're heavily involved in cat-friendly homing in organisations, and as part of the coaching programme, and we've had some videos on this as well, haven't we? How it's, you know, people from all over the world have been engaged in this programme, but part of it is a coaching programme that again we've heard a little bit about. So, you know, we talk about how those measures, the cat-friendly homing programme, can actually reduce the euthanasia rate. Can you, you know, have you seen that put into play? I mean, just as Candice was talking about there.
Very much so, and it's really nice to see Candice because I was Candice's coach, and you know, had the privilege of working with her and her team. So that was actually fantastic.
Brilliant.
Cat-friendly homing. The interesting thing is there can be a situation where you are coaching a shelter and no animals are being euthanized.
Yeah.
But what you actually identify through working with the shelter is that there are a number of cats who are not okay, who are suffering. And as we know, the cat is such a complex species. They're very self-reliant. They don't want to show their pain or their suffering. They don't want to look vulnerable. And I think, Claire, you said it, once you see it, you can't unsee it.
Yeah.
And then if you spend time with your team sort of explaining to them what certain behaviours and expressions and postures mean, then suddenly they see, no, this is not good.
Can't have this.
We can't have this.
Yeah.
So what sometimes happens as part of that initial process within cat-friendly homing is suddenly a couple of euthanasia decisions are made. And that feels painful. But as coaches, and Claire is a fellow coach as well on cat-friendly homing, what we can do is we can sit with them. We can be part of that discussion. We can support each other and enable them to say, do you know what, I think that we cannot relieve this. Now we've identified this suffering, we have to do something about it. And it's a very emotional thing. It requires an awful lot of bravery and courage on the part of people when they do discover this. So once you get over that phase, once you start looking at bringing in this new way of working, this model, and Candy said it, one of the cat-friendly homing essentials of the model is only take in cats who are suitable to be pets.
Yeah.
Then once you get the model going, you don't have those situations where you suddenly spot a cat and think, how many months have you been here for? Oh my goodness, you've been here for 6 months, have you really? Well, you're very quiet. You don't get any of that. Because part of cat-friendly homing, there's a thing called the traffic light assessment, whereby every single cat is monitored and assessed on a regular basis. Are we meeting your needs? Are you okay? If you're not okay, what are we going to do about it? You know, it's not just saying, oh, he's not okay, and then moving on. You have to do something about it. So the cats you have in care, you're constantly individualising their care and prioritising them moving through the system. I think it was Caroline made a wonderful point about rescue, and the emphasis always used to be the scooping up, the rescue. And then it's almost like you sit and look at all the cats in your care and think, now what? Oh, well, somebody will come along. Whereas, you know, the RSPCA are realising as well that that's not the way to do it. We have to make sure that every single cat that comes to our attention, we say, what's right for you? And they come into shelters only when all the other possible options are considered. We have to stop thinking about the shelter as a good place to be.
And that's sort of term, just rescue, isn't it? Brilliant thing to do, but actually we need to step back.
And the people who work within the sector are brilliant. They're courageous. They're amazing. They go the extra mile. But actually just that act of rescue, that intense sort of reactive, dramatic way of working, it takes its toll on people mentally. And one of the things we say, is it not, Claire? We say, look after yourself first. Because so many people do not look after themselves. Look after yourself first, then you're going to be better equipped physically, mentally, emotionally, to look after all those cats.
And Nat mentioned that, didn't she, earlier as well, because, you know, you can't do anything if you're not there. So you've got to,
What was that lovely analogy? You can't drink from an empty cup or something?
Yes, I know. I've never heard that one. But absolutely, yeah. I just wonder whether it's just worth bringing in, just because there we're talking about, you know, the shelter learning about sort of assessment, etc. But there's also the public perception, and has anybody, I don't know if anybody would like to come in just in terms of, you know, that idea that euthanasia can be the best option in certain situations, coping with some of the public aspects of that, because I think that can be really tough for people as well. Caroline.
Yeah, I mean, obviously, I'm very aware that this is, you know, the UK perspective, but it is quite an interesting journey that we've gone on as an organisation. So the RSPCA, obviously very high profile, and traditionally, you know, there were certain segments of the media who were not positive about us, and we would come under a lot of attack about euthanasia, and it had made people really concerned about talking about euthanasia. But we have done a lot of work to really flip that, to really be more open about where euthanasia has been the outcome, and actually explain why as much as we can, and to, you know, be keeping a close eye on our social media, to have, you know, advocates out there in the community. And, you know, what we found is that over time, we still have some people who will leave negative comments. You know, there are just some people who ethically will never agree, but they are actually really outnumbered by people who are supportive, who are trying to understand, who are engaging and supporting of us. So we've really just learned that we will always get some of those negative comments, but actually, if they're really outweighed by positive, supportive understanding. And I especially think for the RSPCA, it is really important that we stand up in this space and say, we are euthanizing as a positive welfare outcome, because actually if we don't, you know, it makes it very much harder for everyone else. So I'm a really strong advocate for openness and honesty. We used to leave the outcome just hanging, but now if we have performed a euthanasia, then it should always say.
Absolutely. Thank you. I've got a few people wanting to come in.
I was just going to say, you know, the paper looks at that and the need to have your whole organisation cohesive. Because if there's people who don't agree in there, it makes it even more difficult when there's people outside. So there's a whole section on how you can bring everybody together to try and work up what you're going to say as an organisation, how you're going to be open about it, what you're going to say on your website, so that everybody feels confident with an answer as well, because there are individuals everywhere. It's not just the press office that gets things. And so people are happy to have a response that they feel is thought through and, you know, is all about cats and their welfare.
Yeah, really good point. And again, that's a bit of proactive thought processes before proactivity rather than reactivity. Adele, did you want to come in there as well?
Just to add something from the perspective in Greece, something I've noticed, I've been here around 3 years, and something I've noticed is that no organisation has a euthanasia policy on their website or openly talks about euthanasia. Last year I worked on a project with one of them to develop a euthanasia policy, because a lot of organisations also don't have policies in general for euthanasia. So this was really interesting to go through and talk with the whole team, both the field workers and in management, about what a euthanasia policy looks like. But I also feel that if none of us openly talk about euthanasia, or collectively as organizations, as veterinary coalitions, whoever, acknowledge what these euthanasia policies are and why we do them, that we're trying to pursue good welfare outcomes for the individuals in our care, then perhaps it will continue where the public does not understand why these decisions are made and are critical as well.
Yeah, such a good point. And I think things like the paper can help with some of that. You know, having something there written as well is really helpful. So thank you. I can't believe how quickly the time is going. So I'm just going to shift a little bit because I can see that we've got some great questions as well from you guys out there. So please do keep them coming in. But I just want to turn to the subject of pregnant spays now as well, because I think it's quite important that we do talk about that as well. So if I could just go to Candice, please, just in terms of those, you know, it is part of the end of life decision in terms of, you know, there's a lot of emotion about pregnant spays and kittens not being born and, you know, ending a life before it's even begun. So I'd love you to share your perspectives on that, please.
Yeah, so I think because we see so many cats without homes, we almost feel ethically obliged to prevent more animals from being born that are going to contribute to the pet overpopulation problem. So I have no problem with performing pregnant spays, and we also know that neonatal kittens often struggle in the shelter environments because they're just so susceptible to infectious diseases, and I expect the Queen would also find that situation quite stressful as well. It is accepted that the fetus doesn't become conscious if it remains in the uterus, and therefore death will occur without suffering. And this is irrespective of the stage of pregnancy, so the spay can be performed at any stage of gestation. I think it's important to help prevent cat overpopulation to prevent them from being born in the first place. And you could argue that pregnant spays also help to prevent suffering overall.
I think it's a really good point just to sort of say about the fact that, you know, that they never become conscious, because I think there's quite a lot of talk, isn't there, and misconceptions about that. So I think it's really important to sort of understand that. Chicha, could I come over to you? Just what's your experience of pregnant spays where you're working? Is it something that you're able to do?
Yeah, so in Indonesia, there's really no consensus in our profession for vets to do pregnant spays. From what I've observed is that vets who are familiar in doing cat population management are confident to do it because they understand the urgency and the necessity of the procedure. But the vets who are not familiar with cat population management are very hesitant to do it. And I think this kind of like perception comes from our deep cultural and religious beliefs. I come from Indonesia, so and in like many parts of Asia, we have this sort of like fear of ending creatures' lives because we're afraid that it might be a sin in some religion, and somehow it can bring the harm back to themselves or to their loved ones. So, which is completely understandable because of, you know, where we are from. But yeah, ultimately speaking as vets, the question is like, how do our choices reduce suffering? It's not just about being for or against like abortion, spay, euthanasia, or spay and neuter, but yeah, it's really about understanding what will effectively improve the welfare of the cats and how do we reduce their suffering.
Yeah. So, and it is, you know, you just bring up a really good point there in terms of just the cultural elements that are in different parts of the world in terms of some of those beliefs as well that we need to be able to have conversations about. And before we go over to the Q&A from you guys out there, could anybody talk to me? I don't know, Adele or other people that have come across real opposition to pregnant spaying and how that might have been overcome. Has anybody dealt with that? Adele, yeah, come in, thank you.
Yeah, sure. Chicha made a good point on this earlier. And to support that, from all the countries I visited, I think generally many, if not most people in rescue seem to view life as better than death no matter what. In my opinion, I think suffering can be worse than death. And I think in the majority of the world, this question concerns cats born outdoors. So we know that up to 70% of cats born outdoors will not survive past 6 months. So if we are considering cats born outdoors, I personally view pregnant spay as a better welfare outcome than anything else they're going to experience once they're born, because there is so much potential suffering once they're born. And this kind of seems like the one opportunity we have to prevent suffering for each of those kittens, potential kittens, but also the mum cat. I had a friend recently ask me, they have no experience in animal rescue, and so they asked me about pregnant spays and asked me if I feel bad taking a cat for a pregnant spay. And I realized there's such a long list of preventable suffering and death issues that they face, and this is why we take them for pregnant spay and prioritize them. So young cats, for example, especially on their first pregnancy, they sometimes reject the kittens and they die. Cats can be pregnant by multiple cats, and that means the fetuses can be at different stages of gestation. And so when some are ready to be born, some will not, and therefore they will not survive once they're born. We all see high rates of sickness, especially in kittens, and mum and dad cats are already sick adults, and they pass that to the kittens and they get sick and they die. A lot of kittens, they will lose their sight from viruses and diseases that they're born with or exposed to when they're young. And I always, in the back of my mind, think this cat may actually not be pregnant. They may have pyometra, which is a life-threatening infection of the uterus. They could have a hernia or an injury, or they could just be full of worms. And so for all of these reasons, I want to prioritize taking that cat to get a pregnant spay to not only save her life, but to prevent the suffering of all of her kittens. So I think talking about what we see in the field and conveying that to people who don't understand why we do this and that we are trying to achieve a good welfare outcome could be helpful to show people why.
Absolutely, yeah. I think that's such a good, just bringing it to life as well, Adele, because I don't think the death rate is just not talked about, is it? It's really important. So thank you. So without further ado, I'm going to go because we've got so many questions coming in, and there's some really, really good ones. So thank you, those of you that have put them in. Any that we don't get to answer, just to absolutely reassure you, we are committed to giving you responses. So just make sure you signed up for the Unowned Community iCatConnect Community newsletter email, that we'll be able to answer those questions on there in days and months to come. So I'm just going to throw this one out, just the top one, that's do you believe that the decision of euthanasia is only on the part of the vet? So I don't know whether, maybe Caroline, do you want to come in first on that one, and then anybody else can come in afterwards?
I think that's something that we've really learned, is that it can be, but that's not a good thing. I mean, obviously the vet has, I mean, in the UK, in terms of the access to the drugs, you know, it is it's not legally an act of veterinary surgery, but it is what the vet has to do. And so, you know, the vet can take that approach of, you know, my decision, I decide, but that doesn't really go well in the medium to longer term, not even in the short term. You know, it does have to be around that team approach, and we use tools that allow the animal caregiver to bring their experience and their views to, you know, we need that information as well from the animal caregiver. We need them to feel that they can be very open and honest about what they're seeing with those cats, the behaviors that they're seeing, you know, to feel that they can do that in a safe way. So I think that, you know, we really do need to make an effort to create a kind of team approach where people will be heard, but they understand their role and remit as well. Yeah. You know, we're not trying to create mini vets, but we're valuing the expertise that other people bring, and pulling that all together to help make the decision. Yeah. Now, I mean, in the UK, I think also we do have a slightly, you know, we have another level, which is actually, you know, within our law, it is actually illegal to allow animals to suffer unnecessarily. Now, what we mean by unnecessary suffering is another matter, but I think there is something that does kind of strengthen the position that vets take around euthanasia is that the law does allow for vets to, to proactively euthanize animals if they are suffering, and I think that's probably fairly unique to the UK. But again, I still don't think that vets sort of, authoritarian sort of, well, I need to do this is really helpful. That isn't the way that we try and do things.
Yeah, thank you. Absolutely. Anybody else like to come in on that? Just in terms of the vet being the only person or not?
Can I just say
Yeah,
something?
Vicky, yeah, go for it.
What I've experienced in some of the shelters and homing centres I've worked with is they've progressed along their cat-friendly homing training. They've made a decision, and we have a 6-step decision tool to enable them to show every single element of their decision making, so that people can see why they made the decision, what they considered. It's like having it in writing, you know?
Yeah.
And then they make up their minds, they arrange for an appointment with the vet, and the vet then turns them down.
Oh, right.
And that makes them feel very guilty and ashamed for doing, so I think it's really, really important when you're working with your veterinary partners and vice versa, that you set down the rules of engagement to start with.
Yeah.
There will be times when we will make these decisions. Are you okay with that? What part do you want to play in that decision making? So that everybody's clear, even about pregnant spays, all the things that we've talked about. There's no situation where in an emergency moment, a split second decision is having to be made, that all those ground rules are laid out to start with in that working relationship. And I think that way, the vets can support the shelter workers and vice versa.
Yeah, and it is about having those conversations earlier on, isn't it?
Yeah.
So that we know where we're coming from on the same, and making sure that they understand where people are coming from. No, absolutely.
Can I
Yes,
just
Claire.
add, in one of my coaching groups, and I actually went to one of their meetings, they have their weekly meetings about all the animals, and I'm sure lots of people do this, but it was lovely to see their vet was on the Zoom call into the group. So they all discuss all the animals, which is great, but everybody is learning at every point. And they take that forward to the next discussions of the next animals.
Yeah.
And so you're building up that experience and expertise, and everybody is hearing each other's point of view. So, in terms of being a learning process, it's really useful.
Yeah, no, absolutely. Right, let's try and get some quick fire. Just in terms of, got a question here from Lucia. Just many questions would be how to have this conversation that we're talking about with the communities caring for cats, not with the veterinary professionals, but those feeders and carers we talked about at the beginning, as this could be a really divisive topic. Yeah. So any thoughts on how we have those conversations with those individuals? Anybody like to come in on that?
I'm happy to
Thanks,
say
Vicky.
something.
Just put your hand up if you've got something to say, and I'll come to it.
It is difficult. It is really difficult. And I think the important thing is the first thing you need to do is build up a relationship of trust with the people you're working with. We've talked all throughout today, haven't we, about the importance of every single one of these different stakeholders. They all have a pivotal role to play in this. So there's got to be that mutual respect and that trust. And then I think approaching the subject very openly and just listening to what people have to say about it. And I think sometimes understanding where people come from, understanding their sensitivities and their emotional responses enables you to have these conversations. I don't personally think you can rush these conversations. I think you have to have them respectfully and patiently. And even though, I love listening to what Adele was saying about, all these reasons why a pregnant spay makes perfect sense for her, all the suffering she's preventing. But that's because Adele's gone on her own personal journey. She's had her own personal experience. And a lot of people that we're talking to will have not had that personal experience. So we need to understand from where they come from, but take the time to actually put forward our point of view. I think it's a really important discussion. It's not something you can rush.
And I think that listening is a real key element. Otherwise, it just keeps coming back, doesn't it? If you don't feel heard, exactly. It's no, absolutely. Caroline.
Yeah, just to completely agree, but also just to say that it may not be that it's about identifying who's the right person to build up those relationships and have those conversations. And I know we're starting to hear more about the concept of the veterinary social worker. And I think that that's really an interesting one, and something that we're exploring, where we have, maybe an owner or a situation where there are multiple cats and there's a lot of challenges there. There can be ethical, mental health, all sorts of other issues in there, and obviously we are not trained in those situations. And I think it's about recognizing where we have our expertise, and if there are other people who can support, who have those different expertise around communication, mental health, whatever is necessary, being open to bringing them in where they are available.
And it's one of they have a lot of social workers in the States. So I think it's it's really sort of helping some aspects over there. I'm sure there'll be people in America that will be able to comment on that. I'll just move to, we've only got a few minutes left, but just Claire, there's a question for you from Tomoko. Just what about getting members in the non-profit open door cat shelter to get on board? And I presume it's to do with the sort of euthanasia decision-making type thing.
So what do they mean by open door?
I presume it's cat shelters that just...
Take everything.
Yeah.
I think, again, those organisations, people need to really think about the consequences of all that, because I suppose we all want to help everything, but, a bit like, the cats coming down the river, they just keep coming. So at some point, you can't do any more. At what point do you make that stop? Do you do it so that you protect the animals you've already got there, or do you just keep doing it until they're all, having problems? And it's not easy to say no, we know that. If there was only a few cats around and we were all trying to help them to the absolute limit, that would be fine, wouldn't it? But the real basis of it is there's just far too many cats to be dealing with, and we need to do some very well, because you can't do it all. There's a limit.
Yeah. I mean, maybe they need to do the cat-friendly homing course.
Well,
and also, I think sometimes the stories of people that used to be there and have done things and then have checked, I think that can be really powerful in some of those conversations as well. So, right, so we've got 2 minutes left. So I'm just going to pick up one more, a view from Julie that I don't know if we could help with, just in terms of she says that we need a scale or checklist for mental suffering like we do pain scoring. So I wonder if anybody would like to come in on tools and... do you want
Just mention a tool.
Yeah, would you like
a
to?
cat-friendly homing tool. Yeah. We have a quality of life infographic.
Yeah.
And it's a way to start a conversation. It talks about positive experiences, negative experiences, the intensity of them, the frequency, the duration. And then from discussions about our perception of what the cat is experiencing, we then can look at a scale. Is this a point of balance? Is it a life worth living? Is it a good life? Is it a life worth avoiding?
Yeah.
Is it a life not worth living? So it's all about having those conversations, and we have this infographic to prompt that conversation. But to underpin that, you need to understand what a cat needs, rather than what we think they need.
Yeah, it's understanding behind, and as I say, I have done the cat-friendly homing course, which is absolutely wonderful. I learned a lot, and there's so many useful tools in that course, just in terms of trying to start the conversation and try and have a balanced approach to what we're talking about. Just in the last minute, has anybody else got any tools or things that they found useful in there? Carol or Chicha? I'll go to Chicha just this time, and then thank you. Because language is the other, might be a barrier. I don't know whether that's something you can talk about. We've got 30 seconds left, so just a quick response from you, please. Thank you.
Yeah, exactly. So you just can Google search basically on like checklists on how to assess quality of life of your cats. And they're basically like some checklists that you can like kind of like score them like out of 100. Like when do you consider like euthanasia or like ending their suffering. So that's what I use in the shelter, and we usually translate them to the language that
Yeah.
all the staff can understand, so that it's easy to
It can be,
explain
yeah.
it to them.
No, I know, because we've not talked about language at all, have we? But that's a big thing. But anyhow, we could speak for ages, but we won't. We've got lots to get through. But a huge thank you to all of the panel, all of you at home or wherever you are giving in questions. I'm going to close the panel now, and we're going to go over to hear a little bit of a reflection from Vicky and some great videos. So thank you.
This is such an emotive topic. Thank you for staying with us. As you heard, we are trying to aim towards a way of working that reduces the need for euthanasia decisions. But no matter what we achieve for cats, there will always be a time when we cannot make suffering end, and we have to make a difficult decision. Did you find this discussion helpful? Do you feel empowered to explore ways to minimise euthanasia decisions? How can you support your team when you do have to make an end-of-life choice? Take a moment to reflect.